Hello everyone. In this video, we will see how intelligent and artificial intelligence is there in medicine. I am Dr. Bhushan Thomre, and in this model, we will see and test a knowledge of an AI model on meningitis. We will see how it chooses to treat the disease, what are the goods and bads about it, and what is the final conclusion. In this video, we have chosen a model called Generative Pre-trained Transformer 3, popularly known as GPT-3. It is a model developed by OpenAI, which is a company backed by Elon Musk. It is trained on a whopping 175 billion machine learning parameters. It is a model which is a state of the art in natural language processing. Something about the model, it is trained with the data collected from 410 billion tokens, which means in English nearly about words. So majority of the data, about 60%, is taken from the common crawls, then some from the WebText2 database, Book 1 and Book 2 database. Whole Wikipedia consists of only 3% of this database. Now we will start a conversation with an AI and we will tell how it goes. For this model, the first prompt what we have given is that the following is a conversation with an AI agent, and the AI is a doctor and expert in medicine and knows how to treat meningitis. The first question I asked him was, what is meningitis? Let's see what its reply.
Meningitis is an inflammation of the meninges, the membranes that surround the brain and spinal cord. It can be caused by a variety of factors, including viruses, bacteria, and fungi. Symptoms include fever, headache, and neck stiffness. Meningitis can be fatal if not treated quickly, so it's important to seek medical attention if you think you might have it.
So as you can see, it can tell exactly what meningitis is and it can explain it very gently in non-medical terms. Now let's go to the second question. After that, I asked it what are the signs and symptoms of meningitis to ask further about what a doctor should know. So let's see how it replies.
The signs and symptoms of meningitis can vary depending on the cause. In general, they include fever, headache, and neck stiffness. Other common symptoms include nausea, vomiting, and a rash.
So it knows something about the signs and symptoms, and some important symptoms like fever, headache, and neck stiffness it can tell you about. Then I asked it, can anyone get the meningitis?
Meningitis can affect people of any age, but it's most common in young children and older adults. It's also more likely to occur in people who have a weakened immune system.
So this kind of question might be important for a general public to see whether or not they can get a meningitis. Afterward, I asked what are the causes of meningitis in children to deal into any specific kinds of meningitis. And it replied
There are
with,
many causes of meningitis in children, including viruses, bacteria, and fungi.
so it's kind of a repetition from our first question that these are the causes of meningitis and these are same in children. It's partially true. Then I asked which bacteria causes meningitis in children particularly.
The most common bacteria that causes meningitis in children is Streptococcus pneumoniae.
So it can tell you which bacteria it can cause. Then I asked, name 5 most common bacteria causing meningitis in children.
Streptococcus pneumoniae, Neisseria meningitidis, Haemophilus influenzae, Escherichia coli, and Group B Streptococcus are the 5 most common bacteria that cause meningitis in children.
So that was a little bit accurate. Afterward, I asked what to treat meningitis in children.
Treatment for cerebral meningitis in children depends on the underlying cause. If the cause is a virus, antibiotics may be prescribed to treat any secondary bacterial infection. If the cause is a bacteria, antibiotics will be prescribed along with other treatments, such as corticosteroids, to reduce inflammation.
So it is a typical answer by a MBBS doctor and it knows at least about something about meningitis, how to treat it in children. So next, I asked what antibiotics are used for the treatment in meningitis in children with Streptococcus pneumoniae particularly.
The antibiotics used for the treatment of meningitis in children with Streptococcus pneumoniae are penicillin, amoxicillin, and erythromycin.
So it can tell you to what antibiotics Streptococcus pneumoniae are sensitive to. Okay, that was good. Then I asked what does what doses of amoxicillin are given in pediatric meningitis.
The recommended doses of amoxicillin for pediatric meningitis are 50 mg per kilogram per day divided into 3 doses.
So that was good. That is something a doctor should know, and it also knows. So that's kudos for GPT-3. Then I asked what antibiotics are used in tuberculous meningitis and what are their doses according to the current guidelines. So I asked particularly about tuberculous meningitis in this question. Let's see how it replies.
The antibiotics used for the treatment of tuberculosis meningitis include isoniazid, rifampin, pyrazinamide, and ethambutol. The dosage of antibiotics depends on the age of the child and the severity of the infection.
So that was impressive. It knows how to treat tuberculous meningitis also, and in general tuberculosis as well. Then I asked, what are the doses of HRZD in TB meningitis in children? Here I have used some of the medical terms like HRZD, which is particularly used in a clinical setting. Let's see how it replies.
The recommended dosage of HRZE for tuberculosis meningitis in children is 10 mg per kilogram per day for isoniazid, 20 mg per kilogram per day for rifampin, 2 mg per kilogram per day for pyrazinamide, and 25 mg per day for ethambutol.
So that was another impressive thing by GPT-3. It can tell you the doses of the drugs also. That was really impressive. Then I asked finally whatever it knows about pediatric viral meningitis by asking describe in detail clinical symptoms, signs and treatment of pediatric viral meningitis. So let's see how it replies.
The symptoms of viral meningitis in children include fever, headache, stiff neck, and nausea. The signs of viral meningitis include eye redness, photophobia, and poor feeding. Treatment for viral meningitis includes antibiotics if a secondary bacterial infection is present, along with plenty of fluids and rest.
So that was also okay, and it can tell you in general what is the clinical symptoms, what are the treatments and signs of viral meningitis also. As you can see, particularly it has noted what viral meningitis symptoms will be there, and that is a good catch. Okay, so that was our conversation with the AI, and we came to the conclusion that it knows a lot about meningitis. So it has a very good knowledge base. It can help guide doctors how to treat a meningitis if someone is junior, and it can tell and guide them. And it can also be used to answer few of the questions which are asked by a general public. So that is a good to go thing, as doctors need not tell as much information as required, and patient might also feel comfortable asking such questions to the artificial intelligent agent rather than a doctor and worrying and trying to worry them a lot. Then it has also given some of the detailed answers like doses of the HRZD, which was quite impressive. But there are some cons, like always, and for that I found out that you have to ask very specific questions to it to get an answer out of it. So basically it means that you should know what you are asking about, then only it can tell you the answers. And it doesn't know much more than a junior doctor, but that might be dependent and that can be overcome just by giving it more data and more medical books to study about. But it is only factual knowledge, and application of it, I don't know whether it's generically can be applied or not. So that only time can tell us. So that was good. So but the main question is, can it replace a physician? So I think not yet. It has a quite a knowledge base, but a more specific knowledge might be required, and it has to develop a more practical skills. But for conversation purposes, it's really impressive. the knowledge base and repetitive branches in medicine are little bit at risk, like medical diagnostic, pathology, anatomy, and radiology reporting, etc. So thank you. If you have any questions, you can email me at bdthomre@gmail.com. Thank you. This is PNB Production. See you next time.